Topical steroid withdrawal, TSW, is a condition that can occur when an individual stops using topical steroids after a prolonged period of use. Topical steroids are commonly used to treat skin conditions such as eczema, psoriasis, and dermatitis. However, with long-term use, the body can become dependent on the steroids, and when they are abruptly discontinued, it can lead to a range of withdrawal symptoms. These symptoms can include redness, itching, burning, and peeling of the skin, as well as systemic symptoms such as fatigue and fever. TSW can be a challenging condition to manage, but with the help of a healthcare professional, individuals can slowly taper off their use of topical steroids to reduce the risk of withdrawal symptoms. Other treatments, such as moisturizers and anti-inflammatory medications, may also be recommended to help manage symptoms during the withdrawal process.